I'm blessed and I'm from the Leadership Initiatives. Could you tell me your name?
Hello, Bless. I'm Dr. Hamza. I'm going to be your guide, and that's your patient you can see.
Okay.
So, yes, the patient's name is John Olga, and he's 28 years old.
Sorry, can you repeat that? 20 years old?
His name is John Olga, and he's 28 years old.
Okay. Hi, Janoga. Could you tell me why you're here?
Wai, me ya faru ka zo asibiti? Okay, he's been having this fever for the past 1 week with associated headache, joint pains, and abdominal pain, abdominal pain, and generalized body weakness.
Okay. Is there like anywhere specific in the body where he is in pain?
Okay. Why? Yes, he actually said he has abdominal pain
Okay.
and joint pains.
Okay. So, is there anything that makes this pain better?
Okay. Why wannan ciwon pain in nan, ko joint pain ko abdominal pain, is there anything that makes it better? Okay. He said the pain gets a little bit, he gets some relief when he takes an over-the-counter drug, paracetamol.
Okay. And is there anything that makes the pain worse?
Okay, akwai wani abun da idan ka yi pain ɗin yana ƙaruwa ne? No, he does not know any aggravating factor.
Okay. Could he rate the pain from the scale of 1 to 10, 10 being worse?
Okay. Wai wannan pain ɗin, abdominal pain ɗin nan, in ka rating ɗin shi on a scale of 1 to 10, nawa aka ba shi? You give it a 6.
A 6. Okay. And he mentioned that he has a fever. Is it persistent or does it come and go?
Wai zazzaɓin nan naka yana nan ko da yaushe ne ko yana zuwa ya tafi ya je ya dawo? Okay, the fever is actually intermittent. It
Intermittent.
comes,
Okay.
yeah, yeah,
Comes
it
and
comes
goes.
and goes. Yeah.
Okay. Does he have like any gastrointestinal issues like diarrhea or constipation?
Okay. Wai kana da kaman gudawa ne ko kuma constipation haka? Oh, okay. He he actually has, aside from the abdominal pain, he does
Mm-hmm.
not have any diarrhea or constipation or vomiting.
Okay. Does he like is he coughing or no?
Where akwai tari? No, he doesn't have any cough.
Okay. Has he been vomiting lately?
Wai kana amai ne kwanan nan? No, he doesn't have any vomiting.
All right. Could I ask about your family history if they have been having this kind of symptoms?
Akwai wani haka a gida wanda yake da similar symptom? No, he's the only one actually that has similar symptoms.
Okay. Could you tell me more about your environment, like where you're living? Are you surrounded by contaminated water or still water?
Wai kaman a gida, ya, how is the environment? Akwai kamar ruwa ne wanda baya gudu ko kuma wani abu haka? Okay, he doesn't, actually they don't have any stagnant water uh, around in their home, and but they have some mosquitoes.
Mosquitoes.
Yeah.
Okay. Do you feel tired or do you feel tired at all or are you
Why? Okay, wai kana jin gajiya wani lokaci haka ko kuma hmm? Kana gajiya? Yes. He actually does feel tired and has some fatigue sometimes.
Fatigue. Okay.
Yeah.
When you rest, does this tiredness go?
Wai idan ka huta, kaman kana jin ƙarfin ka ya dawo? Yeah, not really. Even when he rests, the fatigue is usually there.
Okay. And you told me about that you had some tendon pain? I mean joint pain, sorry. Could you tell me more about that?
Wai ciwon gaɓoɓin nan da kake ji, za ka iya gaya mata more about it ya yake ma? Mm. Okay. The joint pains involve mainly the larger joints, the knees, the elbows, the shoulder joints, and not really, there's not any joint swelling, but he usually gets tired when he walks for short distances, and that's pretty much what he says about pain.
Okay. Could you tell me more about what you do for, like, what is your occupation?
Wai me sana'anka wana? Okay. He's an engineering student at a university.
Okay. I'm gonna switch to diet. Could you tell me more about what you have been eating lately?
Ko za ka gaya mata kamar mainly diet ɗinka ya yake? Okay. He takes mainly carbohydrates. He takes rice and maize gruel and pasta, sometimes with some fish and occasionally with some meat and some vegetables.
Okay. And tell me more about how you prepare your foods. Do you wash your vegetables often or is
Wai
yeah.
kaman idan za ka yi abinci, kana wanke su ganye ne vegetables ɗinka sosai? Yeah, he does wash his vegetables well.
Okay. Um, okay. Could you tell me about has there been like changes in the color of your skin or your eyes like yellowish?
Wai kana ji kaman idonka ya ɗan yellow ne kaɗan ko kuma kaga paleness haka a hannunka? Yeah. No, he doesn't have any yellowness of the eyes or paleness of the skin.
Okay. Um, what
Would
about
you
could you
like
tell
us? Okay, go ahead. Go ahead.
oh no no go ahead, sorry.
Okay, I just wanted to tell you that we have some examination findings
Okay.
that yes, we took. So whenever you're interested, we can let you know what those findings are.
Okay. Do you have the rapid diagnostic test?
Yes, we do.
Could you
The
tell me? Oh,
yes, the rapid diagnostic test for malaria was actually positive, and we also did a Widal test for typhoid fever that was
okay.
positive.
Okay.
Then we also did a complete blood count that showed a hemoglobin level of 10 grams per deciliter.
10 grams. Okay.
Yes.
So I'm gonna diagnose you with malaria, uncomplicated malaria, and also typhoid fever. And
Perfect.
sorry,
That's perfect.
okay, all right. So for treatment for malaria, I suggest you take some antibiotics. Um, Also, since you're having fever, I also suggest you take antipyrotics. This also goes for your typhoid fever, antibiotics as well. And to just prevent it, try to wash your hands often, like just like sanitation, and also um, try to, if you see some still water, even though you said you didn't have any in your surroundings, just get rid of it if you see one because mosquitoes tend to grow.
Okay, perfect. Sai ce wai za ta ɗan baka ACT da antibiotics wadda suna tunanin kamar akwai malaria da kuma typhoid ko sannan kuma kake amfani da nets da kuma kake shan ruwa mai tsafta kana wanke hannu just to prevent future occurrence na wannan ciwon. Right? So I have explained to him actually all the treatment recommendations that you've said and also the preventive measures. And he is very happy that you doing this for him.
Mm.
And he's going to also comply with treatment recommendations. And I'm particularly impressed that you were able to say that the malaria is actually uncomplicated malaria and not severe form of malaria. So because for severe forms of malaria, we usually treat with IVs, right? So, but you were able to say that the diagnosis is not just malaria, but also uncomplicated, and we can give ACT. So I think you did well. Congratulations, and you should be proud of your performance. Okay.
Thank you so much.
So you're welcome and have a nice day. Okay. Yeah.
Thank you.
Yeah.